बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलाम वालेकुम फ्रेंड्स, उम्मीद करते हैं कि आप सब खैरियत से होंगे। फ्रेंड्स, आज के सेशन में हम डिस्कस करेंगे टेस्टिंग सिम्टोमेटिक पर्सन इन अ कम्युनिटी सिस्टम। तो वीडियो की तरफ बढ़ने से पहले हमारी आपसे रिक्वेस्ट है कि हमारे चैनल को सब्सक्राइब कर दें। चलिए फ्रेंड्स, आज के सेशन की तरफ बढ़ते हैं। इन अ कम्युनिटी सेटिंग व्हेन टेस्टिंग अ पर्सन हु हैज सिम्टम्स completely with COVID-19, the healthcare provider generally can interpret a positive antigen test to indicate that the person is infected with SARS-CoV-2. This person should have CDC's guide for isolation. A positive antigen test results for a systematic person generally does not require the confirmatory test. However, it could be considered if the person has the lower likelihood of SARS-CoV-2 infection. Factors that might indicate a lower likelihood of the infection include living in an area where the COVID-19 community level is low and no known close contact with the someone infected with SARS-CoV-2. A negative antigen test results for the symptomatic person should generally be confirmed with a lab-based NAT, and in this case, several antigen testing that is performed every 2 to 3 days, while systematic may be used as an alternative to confirmatory NAT testing. A negative antigen result for a symptomatic person may not need the confirmatory testing if the person has a lower likelihood of SARS-CoV-2 infection. A symptomatic person who has received a negative antigen test resulting and then a positive confirmatory NAT should follow the CDC guide for isolation. From the date of the first test, a symptomatic person who has received a negative antigen test and then a positive confirmatory that should be considered for the alternative diagnosis and avoid close contact with others to prevent the spreading illness. Then हम देखते हैं testing an asymmetric person in the community setting. When testing an asymmetric person in the community setting for COVID-19, the healthcare providers generally can interpret a positive antigen test to indicate that the person is infected with the SARS-CoV-2. This person should follow the CDC's guide for the isolation. A positive antigen test results from an asymmetric person may need the confirmatory testing if the person has low likelihood of SARS-CoV-2 infection. And for example, a low likelihood of the SARS-CoV-2 infection would be a person who has had no close contact with a person with COVID-19 and resides in a community where the COVID-19 community level is low. So friends, मिलते हैं नेक्स्ट वीडियो में। अल्लाह हाफिज़।